Hi, I'm Dr. Mike Zachek, and I've been at the Graves-Gerber Clinic since 1986. I direct the Sleep Center at the Graves-Gerber Clinic, and I'm also proud to be the director of the sleep centers at Ohio County Hospital and Twin Lakes Hospital, and I do a fair amount of work for the American Academy of Sleep Medicine. I've been dealing with the problem of obstructive sleep apnea for long enough that I've seen a change technologically in how we care for patients. Back when, in olden times, we had to do some rather unusual surgeries to try and help people because we didn't have any tools to treat the disorder. I'd like to discuss with you today a new and different tool that will help some patients that have been treated with CPAP, but perhaps have not had great success. The problem of obstructive sleep apnea has become more readily identified in the past couple of decades. This is in part because Americans have become progressively heavier over time. If we're heavier, there's more blockage in the back of the throat. If the back of the throat's blocked off and we're trying to relax at night, we start to snore. If we're snoring and the airway gets literally sucked shut and air doesn't move, that's an airway obstruction. That's because the tongue, the soft palate, and the back of the throat all relax so much. If we see in the bottom of the screen this curve of oxygen, we'll notice that when patients try to breathe and there's no air moving, the oxygen level drops, which puts a tremendous strain on the body, and specifically on the cardiovascular system. Now, it's estimated that as many as 15 to 20% of males and perhaps as many as 5 to 10% of women have significant obstructive sleep apnea. And again, this is not just modest snoring, this is true drops in oxygen level, true disturbances to sleep, and significant consequences to the body. This slide would suggest that those consequences include not only having sleep interruption, which leads to fatigue and decreased productivity, but it can actually lead to accidents. Some famous accidents have occurred because people have been asleep at the switch. We think of the Exxon Valdez accident, where the guy that was running the boat was drowsy because he worked so hard. The Challenger accident, where the technicians had been up all night and tried to launch the space shuttle first thing in the morning and perhaps didn't make great decisions. All of these types of things are consequence of sleep disruption, and sleep disruption is one of the common consequences of obstructive sleep apnea. Sleep apnea can also disturb the bed partner, and as the slide depicts, the spouse that's sleeping next to the snoring individual doesn't get good sleep either, so it can be a real family problem. I have some patients who simply can't sleep with their spouses because of the noise they make. But most importantly and most significantly, we see tremendous cardiovascular consequences due to sleep apnea. When the airway blocks off, when air isn't moving, when the oxygen level is low, we see problems because the heart is stimulated, because the blood pressure is higher. How does that happen? We have to give ourselves little shots of adrenaline in order to open up the back of the throat. Those shots of adrenaline are good for the airway. They keep the airway open. But unfortunately, they stimulate the cardiovascular system, so all the blood vessels squeeze, the heart rate speeds up. I liken it to driving on the highway. If you're stomping on the accelerator pedal to pass somebody, that's what the car is designed to do. But it's really not designed to sit in the garage all night and pump the accelerator pedal. It wears the engine out. And obstructive sleep apnea is definitely something that can contribute to high blood pressure, heart rhythm disturbances, hardening of the arteries, so more likely to have strokes and heart attacks. Even heart rhythm disturbances can occur, and it aggravates heart failure as well. So treating obstructive sleep apnea can be of critical importance. Many of my patients, and probably some of you, have tried CPAP in the past. I think of my job as being a way to help people with using CPAP. And in point of fact, I like to do a good job. I'm proud to say that 8 out of 10 of my patients can use CPAP and use it well. And for those folks, it's a good, economical, easy approach that treats people without any significant side effects. But that also means that 2 out of 10 patients can't tolerate CPAP for a variety of reasons. Either it's uncomfortable for them, they can't get used to something on their face, they try to embrace this device, it's socially unacceptable to them because their spouse doesn't like it, perhaps the noise the machines make. And so therefore we have to have alternative approaches to the treatment. When we treat sleep apnea with alternative approaches, we've had 2 mainstays in the past. The first are oral appliances that dentists make. These devices are designed to hold the jaw forward, pulling the tongue out of the back of the throat. When doctors are taught CPR, we're taught tilt the head back, pull the jaw forward, get the tongue out of the back of the throat, keep the airway clear. And that's what these plastic devices that are placed in the mouth do at night. One can advance these devices progressively to pull the jaw further out, pulling the back of the tongue out of the back of the throat, and that helps to keep the airway clear. But not everybody has adequate teeth, upper or lower, to support these devices. Not everyone has the appropriate anatomy that makes these devices helpful. We have to have other alternatives. One alternative that we used to a much greater extent in the past was anatomic altering surgeries. What do I mean by that? Well, from top to bottom, we could make more space in the back of the throat by removing some tissue on the inside of the nose, or perhaps remove the soft palate or the uvula, remove tonsils, advance the tongue by certain surgical techniques. Our kids benefit greatly from anatomically altered surgery when we do tonsillectomies and adenoidectomies on them, and that's really the treatment of choice for kids who have big tonsils. But again, not everybody has the appropriate anatomy for surgeries, and we found, and I think this is a good generalization, that not many of these surgeries help people the way we'd like to see them helped. They just don't do a good enough job. And that's where the Inspire device comes in. Inspire has been developed to help people with sleep apnea in the following fashion. A small device is inserted under the skin, right below the collarbone on the right. This device senses when you're trying to breathe in, and it sends a message to the nerve at the base of the tongue. We call it the hypoglossal nerve. That's a fancy medical term. It's simply the nerve that helps the tongue get out of the way. The hypoglossal nerve generator is turned on at night, and you can see this gentleman holding the device over his chest. And there's a pause. It allows you to get to sleep. And then each time you breathe in, the tongue is told, move out of the way. Let's see a brief video, and I may need some help on this technically because I'm pretty good at doctoring, but doing these slides is a challenge. So let's start a video here and see if we can see what this gentleman does. So he's going to take the device out. He's ready to go to sleep. He's going to place it over his chest and push a button. And let's pause it right here, please. Thank you. Now, a word about the device. It's implanted under the skin, and this particular slide shows that there is a sensor in the muscles between the rib cages. This is a new advance that is so new that we don't even have a slide for it. Now we can make a single incision where the device is implanted, and the sensor for the muscles is right in that incision. So there are only 2 incisions, one where the device is implanted, and it's about the size of a 50-cent piece, and a second small incision is at the base of the tongue, and that's where this sensor attaches to the nerve that stimulates the tongue. Go ahead and roll the video, please. So every time the patient breathes in, the tongue is moved out of the way. Now you say, how does that work if I have to get up and use the restroom in the middle of the night? Well, you simply pause it, and then it starts back. And in the morning, this device can be turned off, or we can set a timer so that it goes off before you wake up. Now, I'm going to simply stop here because there are some people that would like to give you some testimonials about this device. Let me share this with you. And go ahead and start that video, please. Thank you.
I had a hard time driving. When I was at lights, I put my car in park because I knew I would fall asleep. I'm like, something's really wrong with me. I went in and I did have severe sleep apnea.
At work, I'm forgetting to do simple things that I used to just keep on top of.
I was always looking forward to my next nap. That was my goal in life, is to when can I lay down?
Before I even left from the sleep study, they fitted me with a machine.
You're tethered to this 4.5-foot hose, having something airtight on your face, and then you're supposed to relax and go to sleep, which was really a struggle for me.
I just happened to go online and see this ad about Inspire, and I thought, oh my gosh, I need to look into this.
The more I read, the more excited I got. And instead of feeling defeated, I felt hope.
Once I met the Inspire team, they helped me with my insurance. It was one-day surgery. It lasted about 2 hours.
Recovery was very smooth. I had no pain.
This little device here is the brains for the Inspire implant.
You put it up on your chest, hit the little green button, and it'll turn itself on. Once I wake up in the morning, it's the same thing. Put it right back up on the chest, and it turns itself off.
There's no mask. There's no device to put in your mouth. There's no machine that you have to clean.
Where before I was constantly changing the alarm. You know, I need to sleep as long as I possibly could. Now I'm like 5:30, I'm up and about.
At work, I'm much more back to normal. I've since enrolled back in college, going back to school to get degrees again.
I'm back to kayaking. I'm back to riding on the back of a motorcycle.
My granddaughter's in theater. I no longer fall asleep in her plays.
I realized, oh my gosh, what a change this has made in my entire life.
You're relaxed, you feel good, you're looking forward to the day. That's how I feel every day now.
I have a whole new outlook on life again, being happy and being able to do everything I ever wanted to do again.
It's not only changed my life, but I honestly think Inspire saved my life.
For 14 years, this is what I actually slept with. Now, this is what I sleep with.
So that was a great testimonial. I'm sure at this point some of you have questions, and if you have them, just go ahead and enter them into the chat. We have someone here that will read those questions to me, and I'll be able to answer them as we go through the presentation live. So if you have questions, don't hesitate to answer them or ask them, and I'll be happy to answer them. So again, this is a device that is implanted as an outpatient, 2 small incisions. Recovery is remarkably brief. Typically, we ask patients to not do a lot of heavy lifting for a few days, and we ask patients to obviously control their discomfort, but people can usually get back to work by the end of the first week or maybe even sooner, depending on how they feel. Questions come up about how long does the battery last. In general, it's programmed to last about 11 years. And people often ask, can I have an MRI with this device? Well, MRIs, of course, are magnetic devices, and we can do MRIs of the brain, we can do MRIs of the extremities, and do those safely. Probably can't do them to the thorax because the device would be implanted. Sort of the same as a cardiac pacemaker. So a pretty simple device. Folks also ask, gee, what happens if I have to go through the airport with one of these things? Will this thing trigger the alarms? Well, as somebody who has a total knee in, yeah, it would trigger the alarm. You have to tell them to go through that thing that you hold your hands over your head, and they'll probably pat you down to make sure that you're not carrying something that you shouldn't. But other than that, it's perfectly safe. There's a card that you are given that will tell providers about what is safe with an MRI, and will tell the TSA, the people at the airports, if this device is implanted, so they won't question you. So it's particularly safe. Is there a question? Yes.
We have a first question. Do you have to pause and restart it if you go to the restroom in the night, or does it pause and restart itself?
So the little remote controller, if you push the green button and hold it over your chest when you're getting up in the middle of the night, can give us a pause. And normally that pause is set at about 15 minutes, but that can be programmed for shorter or longer, depending on your needs. And then the device automatically starts up, so you don't have to remember to turn it back on. It does it automatically. Very good. Thank you. So how does this all work out? What's the flow of things? Well, let's picture that you have had the implantation and now you've come back to the office. We give it about a month for everything to settle down. We want good healing to take place. And part of the initial office visit after implantation is to make sure that there are no open sores or anything like that, which typically doesn't happen. We also want to make sure that the patient then understands how to use this device. We activate the device. And when we do that, the patient is asked to lay down, relax, and we simply ask them to open their mouths a little bit, and we see what happens when the device is turned on to the tongue motion with each breath in. And we sort of get it just to the point where the patient is seeing some motion, and that's when we start to instruct the patient on how they work the remote control. Now the patient's in control, and what we ask them to do is to take the remote control home and over a series of a month or two, gradually advance the stimulation as they're comfortable, as they see how it did. So perhaps every third or fifth or seventh night, the patient will advance the stimulation to the point where their spouse doesn't hear snoring, where the patient feels that they're getting a good sound night's sleep, and then we ask them to stop. Now, we set some parameters so patients can't go overboard, and we always check on our patients to see how they're doing. We want to make sure that the patients are urged, and this is important, we want them to use the device every time they're sleeping. We want them to use it every night and all night. Now, eventually, we want to see how you're doing. We can tell by interrogating the remote that you're putting it on every night, how frequently you pause it, how many hours you're using it each night. What we really want to know is, did it completely eliminate the breathing disturbances? So at some point, now we're perhaps 3 months after implantation, we'll ask the patient to sleep in the sleep center, and we'll do what we call the fine-tune visit. So for patients that are in the sleep center, we're seeing how well the device works, how many breathing disturbances have been eliminated. Perhaps a gentle alteration in the strength of the pulse, or perhaps the duration of time that the tongue is advanced will be adjusted, and we can do that remotely in the sleep center at the time of that visit to just perfect things. We want this thing to work, and we want it to work well. Now, this device has been clinically proven. We think severe obstructive sleep apnea begins at 30 events per hour. As you can see on the graph at the left, the patients before Inspire had on average severe sleep apnea, 29.3 breathing disturbances per hour. After the fine-tuning and all the settings are made perfect, we get patients down to 6 events per hour. This is a 79% reduction. This is the kind of change we expect to see when patients use CPAP. This is considered a great endpoint, and this would be considered a clinical success whether the patient used a dental device, the CPAP device, or the Inspire device. In addition, of course, we want to know how the patient is using the device from the spouse's standpoint. So one of the major concerns we have when we see patients is, how well does your spouse sleep? And if the snoring goes away, we get good reports. And you can see that after Inspire has been implanted, there's an 88% reduction in the bed partner reported snoring. So we made 2 people happy with this device. We asked patients in clinical trials, do they like it? How satisfied were they? 94% of people expressed positive feedback, clinical satisfaction. Very few people felt any dissatisfaction. But perhaps the most important indicator of how well this thing is working is how long people use it each night. When we use CPAP, the government, Medicare, says we'll pay for CPAP if you use it 4 hours a night and 7 nights out of 10. Remember, we want people to use these things every night, all night. And in general, people use the Inspire device about 5.7 hours a night, which is substantially better than what we see with CPAP use in most patients. So patients are using it longer, they're using it more nights, and they like it. Now, is there medical literature on this stuff? Yeah. There are over 100 articles now about this device in the medical literature. We've become very comfortable with understanding it. Some patients have had this device implanted in them for over 5 years now. They've gone back and looked at those patients. These patients have had success that persists even after 5 years. So yes, the breathing disturbances continue to be eliminated and continue to work well without any substantial adjustments to the device. Now, more importantly, and this is a question we're asked in the office all the time, Doc, is it expensive? Will my insurance company pay for it? I can tell you that there's been very broad insurance coverage. Medicare, for example, covers it across the United States. The Veteran Administration and military hospitals provide it. The company has a team of experts that works with insurance companies. 97% of insured patients will get this device paid for with the persistence of the company and, of course, with our office to get this pre-certified. So we're excited that this coverage is better and better. We just learned that many Anthem products across the United States will be covered, and that's news that came out just this week. So with progressive coverage, we have more and more patients that can feel comfortable that they're not going to be out of pocket for something like this. Now, the real question is, who is Inspire right for? And so let me take a substantial amount of time to talk about this. First of all, if you came to me and said, Doc, I'm using CPAP every night, it's working fine, I'm comfortable with it, my spouse is comfortable with it, I feel good, but I saw that little advertisement about Inspire, what is it? I would probably tell them it's something that works for people that don't like CPAP, that can't use CPAP, that struggle to use it, or perhaps because of their social circumstance. They're a road warrior. They sleep in a hotel room 200 nights out of the year, and they're lugging this thing around. If you're using CPAP every night and you like it and it's working, stick with CPAP. It works great. But if you have moderate to severe sleep apnea and you're not happy with CPAP, this device might be for you. So first of all, what is moderate and what is severe sleep apnea? We think breathing disturbances more than 5 per hour is considered sleep apnea, but more than 15 per hour is considered moderate sleep apnea, and more than 30 events per hour is considered severe sleep apnea. Our threshold usually is 15 breathing disturbances per hour to 65 breathing disturbances per hour. We have patients that have particularly profound sleep apnea, and sometimes multimodal therapy is effective for them. That would be a topic for a different conversation. The patient can't be significantly overweight. The medical studies that have been done to date suggest that this device works well in patients whose BMI is less than 35. Most insurance coverage will allow a BMI of somewhere between 32 and 35. Now, those people would be considered clinically obese, but not morbidly obese, not grossly overweight. The best therapy for people who are that heavy is probably weight loss surgery. If a patient loses 100 pounds, there's more space in the back of the throat, sleep apnea gets better. But most patients neither need that nor should they get that kind of surgery if they simply have sleep apnea. The patients have to be over age 18. We have much better treatment for younger people that does not require a device. Finally, and importantly, it's how the airway closes. There's 2 ways that the airway can close, from front to back and circumferentially. So front to back means the tongue drops into the back of the throat. What does this device do? It pushes the tongue out of the way. It gets the tongue out of the back of the throat. If the throat closes off like that, this device is probably not right for the patient. How do we determine if this is a proper thing? Our ear, nose, and throat specialist, Dr. John Ruth, would examine the back of the throat when the patient is mildly sedated, when they're in twilight sleep. We see how the tongue drops into the back of the throat. That literally takes 3 minutes to evaluate, but it's a critical step in getting things right. Now, some people have had sleep studies years ago, and they're still considered to have sleep apnea. Perhaps they've been on CPAP forever. Most insurance companies say, before I go for this device, does the patient still have sleep apnea? And we can do in-home tests to prove that sleep apnea is continuing to be present. And if the study is recent, within a couple of years, we don't have to repeat it. But if it's been more than that time, most of the insurance companies require us to do an in-home evaluation to see if the patient still has significant sleep apnea. Now, this is a very brief conversation about Inspire. Many people want more information about it. So if you would take a second to write down inspiresleep.com, this will give complete list of benefits, safety information. They even have people like the people that you saw in this video earlier that will talk to you. These are patients talking to patients. You can learn from a fellow patient how this device has helped them and get all the pluses and minuses of it. It's a very important thing for you to feel comfortable that you're making a wise decision here. Now, if you need more information about this, again, I'm Dr. Mike Zachek. My phone number is here. There are 3 other phone numbers listed here. One is to speak with someone from Inspire. These are folks that might go over your statistics with you on a personal basis to make sure you're the right candidate for Inspire. If there are insurance questions, that number is listed. And if there are questions for people that are covered by the Veterans Administration, there would be a different phone number for that. So I'll leave this slide up for just a second so that you can copy those numbers down if you have interest. Now, there is an app for this. There's an app for everything these days, and you can get apps anywhere. If you go to Inspire Sleep, you can download the app for the smartphone. There'll be plenty of videos, short ones, that answer common questions that people have about Inspire. Again, it will permit you to connect with people who have Inspire. And for those of you that are beginning the journey of using Inspire, there are instructional videos in case you've forgotten about that. So go to the App Store or go to the Play Store and find out Inspire Sleep app and download it and check it out. So I'll pause here and ask if there are any further questions. Rachel?
Will the Inspire system limit activities?
The question was, will the Inspire system limit activities? Once the device has been implanted and we've given you that first month checkout, the answer is no. You should be able to do pretty much anything you want to do with this device and feel comfortable in doing it. Like all medical devices, we want to be careful not to be in an MRI, for example, where they're going to do it of the thorax. That would probably be one limitation to speak of.
If a patient has a pacemaker or another implant, are they still a candidate for Inspire?
Yeah, so interestingly, the cardiologists always put the pacemaker on the left side, and they do that for very important reasons. The Inspire device is put on the right side. So yes, we can have 2 devices in individual. The other thing, I had a patient recently who had a cochlear nerve implant. So this is a device, this woman is particularly hard of hearing. And she got a device that was inserted here that helps her to hear better. So 2 different devices in the same patient, perfectly acceptable. Well, thank you very much for joining us today. I certainly hope that you've learned something. If we can help you in any way, please don't hesitate to contact us. And I'll just scroll to the screen that has my phone number on it and those other phone numbers, and we'll leave it up there for a few seconds before we terminate this program. Thanks a lot. I hope you have questions. Give us a holler. Thanks.